afternoon. I am Dr. Jamie Michelle Iran Galang, and in behalf of QualiMed Santa Rosa, Department of Pediatrics, I would like to thank everyone for joining us today in our parents webinar. Back to school, handa na ba talaga? Just a few reminders to avoid distractions during the lecture. Kindly follow these instructions. Keep your mic on mute. Turn off your video camera. If you have questions, send to us by typing in the chat box. We will answer your questions during the Q&A session. If you're watching via Facebook Live, kindly send your questions through the comment section of the video stream. Thank you, and let's enjoy the knowledge sharing today. Let's now start our program with a prayer.
Let's place ourselves in the presence of the Lord. Dear God, we offer everything to you during this webinar. May we ask for your blessing and divine providence that the activities set for this undertaking be successful and effective. May we be living witnesses of your genuine love through the implementation of the knowledge acquired through this activity. Grant us your divine wisdom as we go about our daily task after this webinar. This we ask in Jesus' name, amen.
Hello again, everyone. We are sense of normalcy. Already, public spaces are opening up to accommodate more people. Businesses have started operating with people on site again. And our children, and tayo din, are excited at the prospect of getting to attend school somewhere other than their bedrooms or living rooms. But we all know that while we have taken steps to protect ourselves, the threat of COVID, of old and new variants, still hangs over us. As responsible parents, we want to make sure that we are not sending our kids out to the world without protection. This is my own worry, both as a parent of 2 children and as a pediatrician. Today, we'll get to hear about the things we can do to make sure this transition back to face-to-face classes is a safe experience. And now, I would like to give the screen to our dear pediatric chairman, Dr. Rizalida Raquel Gonzalez, for the opening remarks. Good afternoon, Doctora.
Ay, good afternoon. Lumabas ang picture ko. Anyway, good evening, dear colleagues in childcare, parents, grandparents, to the teachers and school administrators out with us there tonight. Maraming salamat po. It's been more than 2 years, no? 26 months to be exact, when our school kids have literally been locked out inside their homes for online schooling. For sure, during the start of the pandemic, everyone was groping. Kahit naman po kami. What now? Should there be an academic break? No one was prepared for a pandemic-ready school nor homes, and even us in the hospitals. Fast forward, schools have started to open. Hybrid ika nga, yung iba nag-start na. But wait, handa na ba talaga? That's why we thought of this webinar last March to guide us, everyone. The general 2-dose vaccination rate is 62% right now in our country to date. And approximately just 30% just received the first booster. Quite low. And very trickle received the second booster. Handa na ba talaga? We are still in this pandemic. Please, no? Remind. Yet we need to open up our schools for the school children's much needed psychosocial development and to boost our economy also. Do not forget that it's not just about COVID vaccination. We need to prepare our kids and the schools and our homes. Baka nakakaligtaan na ang mga much needed booster shots ng primary childhood vaccines tulad ng tigdas o measles, DPT, no, may pertussis, pneumonia, pati na sa bulutong o chickenpox. How about the physical preparations the school needs? Do you have enough hand washing facilities? Hindi lang alcohol, water and clean faucet. Do you know how to distantly safe yung seats ng mga bata? Ano yung pagpasok, pag-exit? About the ventilation, mind you, we need to measure our windows for proper ingress and egress of air inside the schools. About your canteens, your waste disposal, and your comfort rooms. Keep those masks on. Please remind the children, yung mask hindi for 1 week. It should just stay there for 8 hours and keep on changing. And it should be properly fitted. So, kailangan matutunan. Hindi yung ang ilong nakalabas, ang bibig ang natakpan. O yung baba yung natakpan, tapos ang mask nandun sa noo. Let's teach our children the proper way. Handa na ba talaga? I call on again my ever-reliable PIDS host, Dr. Jamie Galang, to call on our moderators for tonight's webinar. Magandang gabi po sa lahat.
Thank you, Dr. I always have the pleasure of introducing our moderator. For our moderator for tonight is Dr. Mark Joseph S. Castellano. He is a graduate of St. Luke's College of Medicine, William H. Quasha Memorial, and he is a current medical specialist, head of Animal Bite and Treatment Center, assistant head of the Quality Assurance of the Medical Department, and also a pediatric infectious disease consultant at the Research Institute for Tropical Medicine. He is also an active consultant here at the QualiMed Hospital in Santa Rosa, UniHealth Southwoods Hospital and Medical Center, Calamba Doctors Hospital, Calamba Medical Center, Global Medical Center at Canlubang and in Cabuyao. Ladies and gentlemen, Dr. Mark Joseph S. Castellano. Good evening, Doctor.
Hi, Doc. Doc Jamie, good evening po. Thank you for that kind introduction as well as to our viewers for tonight. So I am privileged to introduce our speaker for tonight, who will talk about the back to school. Handa na ba talaga? Our speaker for tonight is Dr. Michael N. Crisostomo. He is an infectious and tropical diseases specialist in pediatrics, and he was he trained from UP Philippine General Hospital and had his residency training in pediatrics in Quirino Memorial Medical Center. Presently, he is affiliated with several hospitals in Laguna as well as in the University of Perpetual Health Laguna. And he is presently a diplomate of the Pediatric Infectious Disease Society of the Philippines as well as diplomate of the PPS. So to our viewers, to our parents, to our colleagues. So let me welcome Dr. Michael Crisostomo. Good evening, Mike.
Hi, good evening, Doc Marky. Thank you very much for that kind introduction. Let me just share my screen. So for tonight, I will be talking about yung back to school, handa na ba talaga? So my objectives are the following. So I will be presenting the latest local COVID-19 statistics in our country, including COVID-19 in the pediatric population. So I will also be talking about the effects of COVID-19 in pediatrics, in their lifestyle and specifically on their education. I will also be presenting international and local recommendations on return to face-to-face classes, and will be briefly discussing catch-up immunization prior to school entry. So this is from the Department of Health. So this is as of May 21. So we have a total of almost 3.7 million COVID-19 cases since the start of pandemic. And as of May 21, only 246 new cases were documented. So as you can see in this graph, there is a significant decrease in the number of cases starting the late February to early March. So there is a continuous decrease of COVID-19 cases in the Philippines. For the regions, no, Region 4A, Calabarzon, we are second to NCR, no, for the total number of cases documented and to the total number of new cases for the past 2 weeks. So we have documented around 283. And Laguna is among the top three in the top provinces who have COVID-19 cases. So again, this is as of May 21. So as you can see in Laguna, they only documented 3 new cases. So that's actually good news, no? So sobrang konti na lang din po talaga ng cases ng COVID-19. For the demographics, this is from the DOH again. So sa demographics, mas marami pa rin po sa adults, no, reported COVID-19 cases, mostly among 25 to early 40s. Pero as you can see, sa pediatric population, less than 19, meron din po, no? 13% of the total number of cases are among the pediatric age group. Tapos pinaka-common among 10 years old and above. Pero sa number of deaths, makikita nyo po mas madami po sa less than 5. Probably po because yung age group na to, sila pa po yung walang coverage for the COVID-19 vaccine. So this is the Salvation Registry. Ang registry na po ito ay ginawa nung start ng pandemic, no? They recorded the COVID-19 cases in the Philippines in the pediatrics, no? So as of March 31, they have reported 3,221 cases only. Pero dito sa registry na to, mostly po ang na-report po ay hospitalized patients, no? So makikita po dito, no, that almost 42% of the COVID-19 cases in pediatrics, mild lang po ang presentation and almost 22% asymptomatic. So dito po sa asymptomatic and mild cases, medyo underreported po. Kaya ganito lang ho kababa yung cases, no? Pero in the distribution sa age, almost same po sa DOH, common among 11 to 15 years of age. Pero dito po, makikita po na sa 1 to 5 years old, meron pong almost 16 and 11% sa female ang reported, no? Kasi nga po, again, these are the age group na wala pong coverage for COVID-19 vaccine. And sila po yung prone to getting moderate to severe COVID-19. So makikita po natin almost 23% meron din pong na-admit na mga cases ng COVID sa mga bata. And almost 7% meron din pong nagiging severe and critical. In this registry, they also documented the common clinical manifestation of COVID-19 sa mga bata. So, ang pinaka-common po pa rin is fever, cough, colds, decrease in appetite, and DOB. Pero kung makikita nyo po, halos lahat po ng symptoms sa mga bata can be considered as COVID-19, no? Including diarrhea, abdominal pain, vomiting, even seizure, no? Some of them will also present with rashes din po and headache. So what are the effects of COVID-19 pandemic in children? So meron pong studies na ginawa regarding the effects of COVID-19 pandemic on children's lifestyles and anxiety levels, no? This was done in Turkey and it consisted of children between ages 9 to 12. Ginawa itong study na to during the COVID-19 measures were implemented, no, such as complete closure of schools and yung full-time curfew for children under age 20. So they included around 309 children. And sa study, they stated that children experience changes in terms of nutrition. So majority po ng mga bata during the pandemic, they were not able to do physical activities, no? majority po online classes, so nakaupo lang po sila sa room. Decrease ang activity, so yung iba po talagang nag-gain ng weight and naging obese. Some of them also affected their sleeping pattern, no? Pati po yung, syempre, obviously, television and internet use. There was also decrease in social activity, tapos may course time and school success nabawasan po due to the pandemic. So in this study, 36.6% of children spent 3 to 4 hours and 32% spent more than 4 hours in front of TV or gadget. And while majority of the children reported that they slept for 8 to 10 hours per night, their sleeping habits have become irregular, and more than half of the respondents reported that they go to bed late already. So compared to before the pandemic, they saw that the time they allocated for social activity was decreased. And almost 54% of them, of the children, said they never went out, no? Doon lang sila sa bakuran ng bahay nila. They really never went out of their home. So also, children said that they contacted their friends via phone or via internet. And 27% of them haven't met with their friends since the pandemic. They also included this question on that study. So what do you want to do first when the pandemic is over? So majority po ng children answered they want to go back to school, they want to meet with their friends, they want to go out of their house, and they want to hug their loved ones. Kasi obviously po, during the lockdown, di po sila nakapunta sa mga lolo, lola, hindi po nila nakita yung mga pinsan nila, no? So ang una nilang gustong gawin is to go out and meet their friends and hug their loved ones. Also, several studies have been done during the pandemic, and one of them is yung effect of COVID-19 on education. No? So while virtual learning has become a norm during this pandemic, yung transition to online education has brought about adverse educational changes and adverse health consequences, especially for the children and adolescents. So in that study, they saw that there's an early evidence that in children aged 6 to 18 years of age, they experience a significant increase in their expression of clinginess, irritability, and fear. So yung isang major concern din po is the length of isolation that many children have to endure during the pandemic and yung effect nito on their ability to socialize, no? Kasi we all know that the school for many children is the agent for forming their social connections as well as their early social development. So also in that study, 14.4% of teenagers reported post-traumatic stress disorder, and 40% report having depression and anxiety. Because what should have been a time for establishing more independence at school has been hampered by the lockdowns. No? So these social and educational events have been altered or lost, and they cannot be recaptured. This brings us to the questions. Are we ready to reopen our school for face-to-face classes? So the World Health Organization listed some of the factors to be considered on returning to face-to-face classes. No? Deciding to close, partially close, or reopen school should be guided by a risk-based approach, no? To maximize the educational well-being and health benefit for students, teachers, staff, and the community. And yung number one po is help prevent a new outbreak in the community. No? Ayaw po natin na pag nag-reopen tayo ng school, maging cause pa ho yun ng outbreak sa community. So some of the factors that they said that should be considered is yung transmission intensity in the area. So meaning dapat sa community mababa yung case or walang kaso ng COVID-19, and then they should also look into the overall impact of school closures sa education, no, and general health and well-being. And they should also assess yung effectiveness of remote learning. Kasi kung hindi na effective ang online classes, then reopening of face-to-face classes should be considered. Another question to be asked is, are the local health authorities able to act quickly? Halimbawa po, meron nung na-detect na merong COVID-19 sa school or sa mga bata or sa staff, dapat po ang local health unit will be able to act quickly regarding isolation and contact tracing, no? And of course, yung school dapat may capacity, no, to operate safely and collaborate with the local public health authorities kung meron pong ma-detect na may case or may sakit, no? So WHO also mentioned the benefits, no, of school reopening. So syempre, number one po, you will allow the students to complete their studies. Kasi alam po natin, no, yung nung nag-virtual or online class tayo, especially po dun sa mga far-flung areas na walang access to internet, walang access sa mga gadget or computer, marami po yung huminto talaga sa school, no? So by reopening, you will be allowing students to complete their studies. Especially yun nga po, yung mga walang access sa internet, no? And as I mentioned earlier, yung essential services, no, to nutrition, child welfare. They also noted that during the pandemic, medyo nag-increase din po yung cases ng violence against children. So this will help prevent when we reopen school. And of course, yung social and psychological well-being ng mga bata. So we all know that yung school is isang lugar where we have access to reliable information, no? So yung mga bata po, especially with the ano po of social media, marami pong disinformation and misinformation. So with reopening, we will be able to decrease, no, yung disinformation and misinformation. And yung benefits syempre po sa society, no, sa economics, no. And alam po natin, lahat po ng parents actually nahihirapan during the online classes kasi hindi talaga nila maiiwan yung mga bata, especially the younger kids, no. So because of that, some parents will hindi po nakapagtrabaho. So with reopening of schools, we will be allowing parents to go back to work. So ang isa pong very crucial factor in deciding in reopening schools is yung infection prevention and control measures in schools, no? So dapat po meron yan. So ito po hindi po mawawala yung community level measures. These are the measures, no, na may evidence based to prevent COVID-19 transmission. So we should be observing this sa mga schools, no? Physical distancing, regular hand hygiene, wearing of mask, and kung meron pong nagkasakit, detection and quarantine or isolation. Importante din po na merong policy, no, sa schools that are in place, no, to protect the health and safety of all the school personnel, including the people at risk, no. So dapat po yung classrooms will be able to do the physical distancing, dapat po properly ventilated po yung classroom, may designated entrance and exit, available po dapat yung mga sinabanggit po natin kanina, no, yung sa hand hygiene, ideally dapat to may sink kung saan pwedeng mag regular hand washing yung mga students, or minimum requirement at least po meron pong alcohol dispenser or hand rub sa mga entrance and exit points or sa mga common areas po sa eskwelahan. Another aspect is behavioral po, no. So we should consider the age, no, and capacity of students to understand and respect measures that are put in place. especially po dun sa mga younger kids, no? Obviously, they will be having difficulty in adhering to physical distancing, no, or and appropriate use of masks. So ideally po sana yung the teachers who should always remind the kids, no, regarding the safety measures, no, yung infection and control measures, no. Sa mga hallways sana meron, ideally dapat to may nag-usher to avoid po yung congestion. So dapat yung foot traffic maayos. So aside from putting arrow signs sa floor, dapat to may nag-guide sa kanila, especially sa mga younger kids. Aside sa mga teachers, dapat ho sa mga infection and prevention control measures, sa bahay po dapat nakikita rin ng mga bata na ginagawa to. Remember po that younger kids learn from copying, no? So kung nakikita nila yung behavior sa house, yung regular hand washing, proper cough etiquette, etc., para magiging second nature po nila to. So parang mas hindi po mahirapan yung mga teachers to remind the students, no, yung mga proper infection and control measures. So dapat po yung mga parents would be also role models po, no. Of course, dapat to may hygiene and daily practices at the school and classroom level. So regular disinfection of the frequently touched surfaces like yung tables, yung chairs, yung doorknobs, no. This should be scheduled, no. Kahit po in between classes, dapat to may regular disinfection ng classroom. Another important aspect is yung screening and care of sick students and teachers and other school staff. So there should be a policy sa school na if unwell, you should not go to school, no. So sick kids should stay home. So importante rin po dito yung cooperation ng parents, no. So kung meron pong mga symptoms, no, yung mga bata, yung mga anak nyo, huwag nyo na pong papasukin sa school. So ideally may checklist sana ito, no, na yung school yung when to stay home. So yung kung may fever, kung may cough, diarrhea and vomiting, rash, headache, eye infection. Actually, nung pinakita ko kanina sa inyo yung mga symptoms ng COVID-19, halos lahat. So kung meron pong symptoms, stay at home, quarantine, and importante rin po na kung may na-detect na may sakit sa school, that they should inform the parents, no, that their kid was exposed to someone who is sick. So para po ma-monitor kung mag-develop ng symptoms. And of course, kung yung return to school, dapat din po may guidelines regarding that. So kailangan po ma-evaluate siya ng school physician, no, kung kailangan ma-clear siya, kung kailangan i-test prior to return to school, then kailangan po may ganun, may mga guidelines, no. Also, schools should identify students and teachers at high risk, no, especially those with pre-existing medical conditions. So, yung mga medical conditions, ang mga example po niyan is yung may mga chronic respiratory disease like asthma, no, yung lahat, yung may mga congenital heart disease, yung mga immunocompromised, no. So, teachers and school staff na more than 60 years and older and those with underlying health conditions are also at high risk. Yung decision po to return to a teaching environment would depend dun sa individual, no? And yung mga parents na yung mga anak nila na may mga comorbidities or may pre-existing medical condition should sign a waiver, no, and consent na pinapayagan nila yung anak nila na bumalik sa face-to-face class. Now, for children who cannot attend classes in person, yung support should be given na to continue po yung online classes, no. of course, yung communication with parents and students is very important. So school should keep students and parents informed, no, about the measures being implemented. And yun nga po, no, kung may exposure, kung may COVID-19 confirmed, then kailangan ma-inform yung parents para po sa proper quarantine and monitoring. School readiness and assessment. So yung DepEd po, no, and DOH collaborated last September 2021 and started implementing a pilot run on face-to-face classes. So nag-start po sila sa 120 schools sa low-risk areas, no, yung mga bababa yung COVID-19 cases. And they have released an operational guidelines. No? So what are the guidelines? So yung operational guidelines include implementation of the prevent, detect, isolate, treat, and reintegrate framework. And yung mga schools should have available water, sanitation, and hygiene facilities or WASH. So ito po yung isa sa pinaka-importanting sa guidelines. No? So yung classrooms, dapat merong sink and faucet where children can wash their hands regularly. No? Tapos, of course, proper ventilation sa classroom, and ensuring that classroom layouts can enable physical distancing. So halos parehas po ito ng recommendations ng World Health Organization. Prioritization of students who will benefit most from limited face-to-face learning. Again, management of foot traffic, no, to avoid congestion and crowding. Tapos, they also recommended na yung school should conduct a simulation of activities prior to implementation of reopening face-to-face. They presented several slides regarding the guidelines, pero I would just focus on the teaching and learning. No? So sa class size, they recommend a maximum of 12 learners for kinder and a maximum of 16 students for grades 1 to 3, maximum of 20 learners for senior high school, and maximum of 12 students for senior high school, which will have workshops and laboratories. No, they also recommended blended learning approach. No, so it will be hybrid, 1 week straight face to face, and then 1 week straight distance learning. So alternate po yan per batch, and class schedule should be arranged equitably so that all qualified learners will have the opportunity to attend face-to-face classes. And again, kailangan po ng consent from the parents. No? They also recommended 1 teacher per class for kinder to grade 3. And only subjects that require lab and workshops for senior high school will be allowed for face-to-face. The rest of the subjects will be on distance modality. A maximum of 4.5 hours stay in school, except for kindergarten. So a maximum for kindergarten is only 3 hours. Vaccination of teachers and school personnel. So interagency task force has categorized teachers and school personnel as under A4 priority. No? So for the COVID-19 vaccine, they are actually included in the priority group. No? So while vaccination is not mandatory, classroom learning will be limited only to vaccinated teaching personnel and students. So for now po, ang number 1 requirement is that they should have COVID-19 vaccines. So what are the additional school-related measures? No? Sa even pre-pandemic po, no, yung ibang schools and universities are already checking the immunization status of the students prior to school entry, no? Especially for college and med school. So usually they require immunization po, no, prior to school entry. And if may mga missed doses or lapse na vaccines, so catch-up vaccination is recommended. So for I think the most important vaccines na required is yung COVID-19 vaccination, no? So for the pediatric population, 5 to 18 years old, I mean 12 to 17 years old, meron pong two vaccines na approved by the FDA. So ang isa po is yung Moderna. So it's a two-dose vaccine, so separated by 28 days interval. And then yung isa po is yung Pfizer, no? Two-dose series din po which is separated by a 21 days interval. Although early this year, na-approve din po yung Pfizer for 5 to 11 years of age with two-dose series din po, pero mas mababang dose. So PPS or Philippine Pediatric Society and PEDSP supports this program, no? So because we all know that COVID-19 also affects children and may also lead to serious consequences. And majority of these cases can be prevented if they are given with vaccines, no? So immunization this pandemic. So marami pong studies din ginawa, no, regarding childhood immunization during the pandemic. So this isang study po was done in India where they documented the data of children vaccinated as per their universal immunization program or yung parang EPI po sa atin or NIP, no. So they retrieved records for a 7-month period where they compared nung pre-pandemic and during the pandemic. So they saw that there was a significant drop, no, in vaccine counts after the emergence of COVID-19. So the maximum drop was negative 87%. Sobrang laki po nung binagsak nung immunization program ng India during the pandemic. A similar study po, no, meta-analysis also was done to assess the magnitude of the impact of COVID-19 pandemic on existing vaccination programs and identify the factors associated with the disruption. So they have seen that the pandemic has affected virtually all countries, no, including the first world countries, no, but they saw a particular threat in low middle income countries, including yung Philippines po, no. These are the factors that they saw in that study, no. So a decline in financial, human, and other resources, social instability, limiting political attention and countries' health priorities, in addition to the devastating consequences of the lockdowns. So in the Philippines, WHO and UNICEF estimated the immunization coverage, of the country. So as you can see, even before the start of the pandemic, there's also for several factors po yan, no, during that time. So, bumabagsak po lahat ng coverage for BCG, for DTP, for polio, for measles-containing vaccines, Hep B, etc. So, the trend is going down. So, before pa po talaga, may mga factors na po, no, nung pag-decline ng coverage, but the pandemic parang worsened the immunization coverage. So, because of this, marami pong mga bata, no, yung na-miss yung mga vaccination schedules, no, recommended for their age. So, which is, kailangan nga po ng catch-up immunization. No? So, catch-up immunization aims to provide optimal protection against disease as quickly as possible by completing the vaccinations recommended. Whether marami pong pwedeng dahilan, no? Either, yun nga po, kung may na-miss or lapse vaccines or recommended for school entry or for travel, may schedule po that we should follow for catch-up immunization. So it is important, no, for the pediatrician or the vaccine providers to review your patient's immunization history and provide catch-up vaccines when needed. So these are some of the vaccines for catch-up for children and adolescents. Sorry for the busy slide, pero this table just represents the catch-up immunization schedule for children 4 months to 6 years old. No? So HEPA B, for HEPA B, um, for unvaccinated children, no, they should complete a 3-dose series. No, so the recommended interval, dose first dose to second dose 4 weeks, and for dose 2 to dose 3 is 8 weeks and at least 16 weeks after the first dose. No, so generally revaccination is not recommended for persons with a normal immune status who were vaccinated before. No? So for diphtheria, tetanus, pertussis, the recommended is 5 doses. Although dose 5 is not necessarily uh, um, you may opt not to give dose 5 if dose 4 was administered at 4 years or older and at least 6 months from the third dose. So the interval, the recommended interval is 4 weeks from dose 1 to dose 3, and then 6 months from dose 3 to dose 4. For pneumococcal vaccines, no further doses needed for healthy children kung nabigyan sila ng first dose after 24 months or older. Pero kung hindi po, ang recommended interval from first dose to second dose is 4 weeks, no? If the first dose was administered before the first birthday. And then 8 weeks as final dose for healthy children if the first dose was administered at the first birthday or after. So ito rin po yung ibang recommended interval if you need further doses, no? Dose 2, dose 3. So 4 weeks if less than 7 months old, and 8 weeks if previous dose was administered between 7 to 11 months, or wait until 12 months old. Or if the current age is 12 months or older, at least one dose was administered before age 12 months. No? For dose 3 to dose 4, 8 weeks as final dose. If this dose is only necessary for children age 12 months and older, no, who received 3 doses before the first birthday. So for MMR, so unvaccinated children, they will need they will need 2 doses, no, 2-dose series with at least 4 weeks interval. For varicella, it's also a 2-dose series with 3 months interval. For flu vaccine, if the patient is less than 9 years old, no, and no history of flu vaccine, 2-dose series, no, for children less than 9 years old and more than 6 months of age, no, 2-dose series with 4 weeks interval. However, kung meron na na-receive before na flu vaccine, it should be given annually. 1 dose yearly po. And then for HEPA A, it's also a 2-dose series with 6 months interval. For the catch-up immunization schedule for children 17 to 18, for Hep B, almost the same, no, for the 4 months to 6. So 4 weeks interval, 8 weeks from dose 2 to dose 3 with at least 16 weeks after the first dose. So Tdap, tetanus, diphtheria, pertussis, for not fully vaccinated with DTaP, 1 dose of Tdap as part of the catch-up. Preferably po, yun po yung first dose, no? And then 4 weeks interval. For the third dose, 6 months if first dose of Tdap was administered before the first birthday. and then dose 4 to dose 5, 6 months. For MMR, if unvaccinated children and adolescents, 2-dose series with 4 weeks interval. And for varicella, if unvaccinated, 2-dose series for 3 months if younger than age 13 years old, 3 months interval, and 4 weeks interval if more than 13 years old. 13 years or older. Human papilloma virus vaccine is also recommended. So routinely recommended at age 11 to 12, but you can give them as early as 9 years old. No? Routine dosing interval, so 2 or 3 dose series depending on age. For 9 to 14 years old, a 2-dose series of 6 to 12 months interval, meaning interval is 5 months. If given too early, meaning less than 5 months, then you need to repeat the dose. No, for more than 15 years of age, 3-dose series, so 0 as dose 2 to dose 3, and then 6 months interval for dose 2 to dose 3. So for influenza, 1 dose for all 9 years or older. Hepa A, same 6 months interval, 2-dose series, and then meningococcal vaccine. Catch-up age is 13 to 15 years of age with 1 dose and booster at age 16 to 18. So minimum interval is 8 weeks. For adolescents more than 16 years of age, you can only give 1 dose of meningococcal. So again, for the vaccine providers and the pediatricians, let's just review the best practice guidelines for immunization. No? So yung spacing of multiple doses. Vaccine doses should not be administered at intervals less than the minimum intervals or less than the minimum age. However, meron pong grace period that they will allow vaccine doses administered less than 4 days before the minimum interval or age considered valid. Pero kung more than 5 days po yan, then you need to repeat the dose. For simultaneous administration, routine administration of all age-appropriate doses of vaccine is recommended for children for whom no specific contraindications exist. No? So ibig sabihin, kahit po ilang vaccine, pwede po yan sabay-sabay ibigay kahit sa isang visit. As long as walang specific contraindications like hindi po immunocompromised or and yung administration of the vaccines, kung isang site lang po, ang minimum space between the two vaccines should be at least 1 inch or 2.5 centimeters. No? So kahit 4 na vaccine sabay-sabay, okay lang po. For the lapsed vaccination schedule, you should administer vaccines as close to the recommended intervals. No? And if an interruption in the vaccination schedule does not require restarting the entire series of a vaccine or giving additional dose, extra dose. No? So kung na-late po siya, you just have to continue lang po yung series. No? You don't have to restart the whole vaccination series. If unknown or uncertain yung vaccination status ng bata, then you will give time for the parents to retrieve po yung records. No? If records cannot be retrieved, then the child should be considered susceptible and start age-appropriate vaccination schedule. So considered po na parang hindi siya nabigyan ng vaccine na yun if you cannot find the record. So in summary, no, COVID-19 disease directly affects children and some children may lead to serious consequences. No? And COVID-19 pandemic affected the children and adolescents, including their education. And like I've mentioned earlier, school closures have clear negative impacts on child's health, education, and development, family income, and overall economy. In reopening or returning to face-to-face classes, there are a lot of things to consider. No? we will need the full cooperation not only of the school staff, the teachers, but also the parents and the entire community. And this outbreaks reminds us of how valuable vaccines are, no, in preventing not only COVID-19 but other preventable diseases as well. So I think this is my last slide. Thank you.
Okay, so thank you very much, Dr. Mike, for that very enlightening lecture. And I know that most of our parents and our viewers tonight have learned a lot doon sa lecture mo, no? So, thank you very much for that discussion. So, Mike, meron tayong mga questions, no? So, may mga iilan tayong question dito sa chat box from Miss Irene Recio. Can we trust the data released by DOH? Now, given that most people who turn out COVID positive opt to use antigen tests instead of the RT-PCR test, and antigen test results are not included in the data for positive cases. So, yun yung tanong ni Miss Irene Recio.
Thank you very much, Miss Irene, for that question. No? So, as I mentioned earlier, medyo underreported talaga yung cases natin. No? Pero mostly, sabi ko nga, yung nare-report are hospitalized patients, no? Especially sa pediatric population. So, bago po kasi ma-approve talaga ng DepEd, meron po silang assessment talaga ng community, no? So they will assess the community kung low risk talaga yung community for reopening classes. Tapos they will also check the schools kung ready talaga sila. They will check the policies, yung infrastructure, lahat po, no? Yung mga sinasabi ko kanina, yung wash, yung kailangan, meron po yun. Yung sa sanitation, water, and yun po, yung hand hygiene. So, importante po yun, no? So, bago po lahat yan, ina-assess po yan ng DepEd and the Department of Health. So, hindi lang po sila tumitingin talaga mismo doon sa data na nire-report, no? So, they will go to the community, check the community for yung readiness, yung school readiness, no? Nung area. So as of now po, no, they started from 120 schools, no, nag-pilot test po sila for 120 schools nationwide sa mga low risk areas. As of now, they expanded to 304. So medyo madami na po. Pero hindi po kasama yung Laguna. Surprisingly, hindi po nakasama yung Laguna. Maybe because nga before, nasa top 2 tayo sa pinakamadaming reported cases. Pero ngayon po, as the cases are going down, reported cases are going down, they will assess again yung community kung ready na talaga.
Okay, thank you Mike for that answer, no. So in addition siguro regarding doon sa mga antigen test results that are not included, siguro i-take natin yung data ng DOH na some of the cases are underreported talaga. So, even though na yan lang yung nare-report, so mag-plus minus tayo doon. So, they are just estimate naman of the actual cases, no? So, thank you for that. And then, may question tayo dito, Mike, na when can students return to school after being sick? Tapos, hindi daw sila na-test for RT-PCR, pero fully vaccinated with COVID vaccine. So, yan, magandang question yan.
Oo, tama. Ang present recommendation, no, is actually kung fully vaccinated ka 10 days, no, if 10 days tapos you are febrile for at least 3 days without taking any medications, no, like paracetamol. So kung wala ka kahit may konting symptoms ka pa, as long as hindi siya nagpo-progress, yung ubo halimbawa hindi nag-progress, pero you are improving, yung bata ay nag-i-improve, tapos febrile siya, for fully vaccinated, it's 10 days. Of course, dapat kailangan merong clearance from the physician, no, pediatrician, prior to school return. Pero retesting is not recommended anymore. So parang time-based strategy yung ginagawa natin.
Okay, thank you, Mike, for that clarification and answer. And then we have another question here. How about guidelines in using other school facilities like playground, restroom, and canteen? Meron bang na-mention ng mga specific details with regards to these facilities?
With regards to other, yung specific facilities, wala naman na-mention dun sa na-review ko na DepEd operational guidelines. No? Again, these are only pilot test, no? Pilot test run, no? So DOH will be releasing the official guidelines, no? Once na sa tingin nila ready na talaga for reopening. Pero as of now, dun sa mga pilot test run, walang specific na na-mention regarding sa canteen and other facilities. Pero parang sa tingin ko magiging parehas lang naman din 'yon, no? Yung mga requirements, no? So sa canteen siguro kailangan talaga meron din available na hand washing area or yung mga alcohol dispenser readily available, no? Tapos yung foot traffic, no, dapat may nag-usher, may mga directions, especially sa mga bata, no? Dapat talaga may nag-guide sa kanila, yung mga younger kids na hindi makakasunod talaga. So dapat may nag-usher sa mga hallway, sa library, sa playground, dapat may nag-assist sa mga yon, kasi nga hindi mo talaga may iwasan yung hindi nila yung social distancing. So yun, dapat ma-remind sila regarding that, no? So for yung specific guidelines wala pa.
Okay. That's for all naman na facilities sa ngayon. Lalo na sa mga bata, tama, no, na mahirap silang i-guide. Kahit sabihin mo na dito ka lang, magtatakbuhan yung mga yan eh. Kasi lalo na yung mga less than mga 7 years old, 6 yan, yung mga toddlers, tama. So, yes, kailangan talaga may nakatutok sa kanila, no? And then, we have a follow-up question pala doon sa first question kanina natin with regards to yung mga sick na gumaling. Need daw ba na magbigay pa ng medical certificate as clearance bago bumalik ng school, or any recommendations regarding that?
Sa WHO, they recommend, no, na prior to return to school ng mga may sakit, that they should be evaluated by the school physician or a pediatrician. So ang recommendation is siguro nga dapat meron medical clearance or medical certificate that they are allowed to go back to school para ma-assess din kung nakumpleto na nila yung isolation nila.
Okay.
Or quarantine.
Okay, thank you. At syempre kapag may medical certificate, mas kampante yung ibang parents na 'di ba, na yung classmate niya ng anak nila ay na-clear pumasok, kasi syempre na hindi nakakahawa. And then we have another question here, recommendation for school service. How many students? May ano naman tayong recommendation with regards to that?
Merong guidelines sa WHO regarding transportation and school service, pero ganun din halos ang sinasabi nila, no? So depende kung gaano kalaki yung school service, no? So recommended nila at least siguro 50% ng capacity ng school bus para ma-practice yung physical distancing. Tapos yung ventilation, so dapat bukas yung windows during the travel, no? Para may passage nung air, may air circulation. So yun lang naman yung mga nabanggit. Pero sa DOH wala rin silang binanggit pa na specific regarding that. Pero most of the DepEd recommendations, napansin ko parang halos kaparehas lang ng recommendations nung sa World Health Organization. So I guess they will be adapting also that recommendation. So yun. So depende sa school service, school bus. So usually hindi puno yung school bus, no, para ma-practice yung social distancing. So syempre of course you need yung mga estudyante dapat naka-mask pa din.
Yes. At saka dapat din, hindi lang enough na naka-mask, dapat may nagpupulis yung proper, kasi yung iba nasa
ibababa ng mga bata.
Okay. So ito, Mike, may isa pa tayong question dito, no. So in the school clinic setup, what to do if a kid suddenly gets sick?
So yun po yung isang importanting aspect dun sa na-consider nila no sa WHO yung reporting to the local health unit saka yung collaborating communication with the parents no. So importante yun. So kung may nagkasakit sa classroom importante na ma-document yun tapos pauwiin ka agad yung estudyante and then inform yung local health unit no yung na merong nagkasakit so kung kailangan i-test kung kailangan i-isolate o i-quarantine kailangan then i-inform yung parents na na-expose yung mga anak nila sa isang nagkasakit para ma-monitor kung mag-develop din sila ng symptoms.
Okay. So ibig sabihin nun Mike, 'di ba, kung magkasakit, so dapat naka-properly document yung
yes.
Kasi baka mamaya nagkasakit tapos hindi na document, bumalik ka agad after 3 days. So the school nurse or yung dapat documented nila. Sige Mike, may in relation to the question earlier with regards, di ba na-mention natin yung mask, no? May question dito, will they be strict on what kind of mask the kids will wear, like cloth, surgical, KN95, etc.? Recommendations ba?
Ang recommendations, basta properly fitted yung mask, no? Pero ideally, sana yung medical grade mask. Pero yun nga, ang recommendation, syempre, yung less than 2 years old, hindi pwede kahit na anong mask, yung less than 2 years old. Pero for 2 years old and above, kasi dapat properly fitted lang yung masks, no? So, tapos syempre, yun nga, nabanggit din ni Dr. Riz kanina nung introduction na hindi pang 1 week yung mask na yun. So, dapat everyday pinapalitan yung mask.
Yes.
Tapos, basta properly fitted.
Okay. Mike, may question si Dr. Riz, no? So, masks are removed and then placed on their desk. Is it possible to restrict eating in school and just eat at home since school hours are recommended to be only 4 hours?
Yes, opo. Parang hindi po yan nire-recommend na magtanggal ng mask tapos wala rin pong binanggit na pwede silang kumain ng sabay-sabay no sa loob ng classroom kasi nga yung risk na pag tinanggal mo yung mask mo na mahawa ka no. So since nga po na limited lang yung hours no yung sa kindergarten nga 3 hours lang tapos sa mga grade 3 and above lang 4.5 hours so siguro wala talaga siyang recess tsaka eating time parang hindi po nire-recommend na tanggalin yung mask talaga.
So tama no. So lalo na yung mga bata hindi mo alam pagtanggal ng mask kung saan na yung pupunta yung mask no baka naapaka na yung iba. So wala palang extanggal ang mask no so patay tayo diyan. So Mike,
nagpapalit-palit sila ng mask.
Oo, nagpalit-palit pa ng mask. Sige. So sa ngayon wala na tayong ibang questions. So do we have any more questions po ba from our viewers or from our participants po tonight? Kasi maganda yung discussion natin kasi very relevant sa ngayon. May mga questions pa po ba? Parang wala no Mike no. So Mike, ito question no. So kung sasagutin natin yung topic natin tonight, back to school, handa na ba talaga? So ano yung magiging sagot natin dito sa sa question?
Sa ngayon no, kung aanuin natin yung risk-based approach no, yung sinasabi ng WHO. So yung risk medyo mababa yung risk no kasi nga yung number of cases are going down sa area natin Laguna as of May 21 tatlo lang yung reported kahit sabihin na nating underreported medyo mababa pa rin talaga yon no and kung yung mga schools makapag-comply yung local health unit makapag-comply I think ready naman na pero again depende pa rin to sa transmission sa isang lugar. Halimbawa, tumaas ulit yung kaso, then kailangan i-hold yung face-to-face, no? Pero sa ngayon, yung risk and yung benefit, no, kung titingnan po natin, no, yung benefit na yung mga estudyante makabalik sa normal na na, na, na buhay, no? So, yung sa normal na development nila, I think pwede natin ngayon, sa ngayon, pwede natin buksan ulit yung face-to-face classes.
Okay. So, yes, handa na tayo sa ngayon. At saka so parang to really give importance na the benefits of opening schools right now will really outweigh yung risk natin, no? Kasi 'di ba sobrang kaliwat kanan yung mga rallies, pero yung mga actually ako halos 2 months na akong walang COVID. So ganun sa Pedia, no, sa Pedia. So halos ganun kababa talaga ang cases natin ngayon. So and then for the parents, no, nabanggit naman to kanina ni Mike na we should follow protocols and policies. And dapat maging responsible din tayong mga magulang. Kasi syempre, kung alam natin na may sakit yung anak natin, huwag na natin papasukin.
Tama.
Kasi iba in denial na, hindi, konting sipon lang yan, konting ulang.
Oo. Kasi nga, ang number 1 priority natin, huwag tayo mag-cause ng outbreak dahil sa reopening ng schools, no? So yun, malaking bagay yung kooperasyon ng mga magulang.
Okay, yes, tama. Tapos gusto ko na rin bigyan ng importance ulit, no, that na-discuss mo naman kanina that for our parents, hindi lang COVID vaccine ang importante. Okay? So as na-discuss kanina ni Dr. Mike na we need also to review our child's catch-up vaccinations at bisitahin natin yung ating mga pediatrician, no? Kasi mamaya wala nang COVID pero nagkabulutong naman, nagkatigdas naman. Okay? And then Mike, last na lang to, may mention si Dr. Aris, no, na I think schools should have hospitals affiliated with to help manage sick kids. So
yes,
yan.
Agree po ako doon. Oo. Yun nga collaboration with the community. Tama.
Yes.
Oo.
Okay, so this has been a very productive evening. I hope po marami pong natutunan ang ating viewers, ang parents, our colleagues with a very informative lecture of Dr. Mike. And we would like to thank you, Mike, for giving us the discussion.
Thank you din, Doc Mike.
Okay. Hi, Doc Jamie.
Yes, thank you, Doc Mike, Doc Mark. Our infectious disease specialist, having been on the front line of the fight during the pandemic po, the country is super grateful for your service, Doc. Kayo ang mga matitibay. Maraming salamat po.
So, we would like to call Dr. Lilibet, our medical director po.
First, Doc, bibigyan muna namin ng certificate of appreciation, Doc. Thank you very much again. In behalf of QualiMed Hospital Santa Rosa, we would like to give this certificate of appreciation to Dr. Michael N. Crisostomo for his expertise and valuable role as speaker during this webinar, Back to School, Handa na ba talaga? Given this 25th day of May via Zoom virtual event. Signed by Attorney Nirmala Barbara S. Vangarja, our Chief Operating Officer, and Dr. Lilibet M. Maravilla, our Medical Director. And also to Dr. Mark Joseph S. Castellano, thank you again. This certificate of appreciation for your expertise and valuable role as our moderator for tonight. Given this 25th day of May, also signed by Attorney Nirmala Vanguardia, our Chief Operating Officer, and Dr. Lilibeth M. Maravilla, our Medical Director. Again, thank you very much, Doc.
Thank you.
So before giving the screen to our Medical Director, I would like to invite everyone again next month, June 28, also at Tuesday, same time, 6 p.m. Our next webinar will be about screening of school-age amblyopia and error of refraction. Ofta naman, tungkol sa mga mata. We really hope you can also join us again. And Of course, our webinar won't be complete without the message of our dear Medical Director, Dr. Lilibeth M. Maravilla. Good evening, Doktora.
Hello, good evening.
Good evening
Naku,
po.
as usual, jump pa kang ng webinar ng Department of Pediatrics. Kasi very timely. Tapos nakakatuwa kasi after this webinar, yun namang mga papasok sa school na kids, you of course have to check their eyes for error of refraction. So talagang siya, series of lectures that would really benefit our children. So nakakatuwa yung lecture kasi di ba yung mga forecast early this year that after election, baka magkaroon ng surge, we're seeing another variant. Pero because we have been fully vaccinated and most of us have been boosted, and then kids are also vaccinated. So we see a very low number of cases. And in fact, even in the hospital setting, in QualiMed STR, we have very, very few identified COVID positive, usually yung mga nag-travel abroad initially, and that was last April pa. But parang one case lang last April. The whole of May, wala kaming cases. So talagang mababa na siya. So hopefully we have converted COVID to an endemic disease. And sana malift na rin yung pandemic. So our children can really enjoy their face-to-face meeting with their teacher and with their schoolmates. Kasi di ba iba pa rin yung sa bahay, iba pa rin yung online, tsaka iba pa rin yung dynamic na nakikita sila, they interact with each other. Iba yung yung nadidevelop na personality ng bata if you're just looking at the computer as opposed to really touching your seatmates, your schoolmates, and talking with them in person. So yun nga, thank you very much for the department's reminders to us that it's not just COVID, but we have to make sure that our children are ready to face school, not just prevent COVID transmission, but prevent as well other diseases from affecting our kids. So very timely yung completing the immunization if you have missed, especially during the pandemic. So QualiMed SCR naman, of course, with our very able and competent pediatricians are very willing to administer all these vaccines that are needed by your children for them to really be ready and be healthy when they resume the activities in school. So thank you very much for all those who have listened, who have logged in, both employees of the hospital and also are members of our communities around. So we hope to see you on our subsequent webinars with the Department of Pediatrics. And I also want to invite everyone, including those, the non-medical people who have logged in today, that because this is Thyroid Month, we also will have a webinar tomorrow naman po. And this is under the Department of Internal Medicine. And this is recognition of the different types of thyroid diseases. So we are also inviting everyone to please join us and to please listen to the lecture and for us to learn some more from our competent endocrinologists in QualiMed STR. So thank you very much, Reese and team, and congratulations again. And thank you very much for our two handsome pediatric IDS consultant, speaker and moderator who had made this webinar a success. And also our very able and charming host for the webinar series of Department of Pediatrics. Talagang team effort. Si Mark, si Jamie, si Mike. Thank you very much for handling this evening's webinar. So back to you, James.
Thank you so much, Doktora.
Thank you, Jamie. Yay! Yeah. I hope the parents got something.